The housing crisis in Canada has reached a point of no return. Once seen as a land of opportunity, where owning a home was a realistic dream for most citizens, Canada in 2025 is a completely different story. The average rent for a one-bedroom apartment in major cities like Toronto and Vancouver has soared to an unaffordable $3,500 per month. Even in smaller cities like Halifax and Winnipeg, traditionally considered more economical, the average rent now sits at $2,000 a month. For the majority of Canadians, homeownership has become nothing more than a fantasy, with the average price of a home in major cities exceeding $1.5 million. Middle-class families, once the backbone of the country, are being pushed to the edge, forced to choose between housing and other basic necessities like food and healthcare. The root of the problem lies in a combination of factors that have been building for years. Despite government promises to curb speculative buying and limit foreign investment in real estate, these issues persist unchecked. Investors, both domestic and international, continue to dominate the housing market, driving up prices while ordinary Canadians are left behind. Bureaucratic red tape has further hindered the development of new affordable housing projects. Even when new units are built, they are quickly snapped up by those with deeper pockets, leaving those who need affordable housing out of options. The situation is dire, with families forced to live in overcrowded apartments, cars, or temporary shelters. The lack of affordable housing is creating a ripple effect across society. People are delaying major life milestones, such as starting families, due to the financial strain. In extreme cases, some Canadians are even considering leaving the country altogether, though for many, that is not a viable option. The government's inability to address the crisis effectively has left many Canadians feeling abandoned, with wages failing to keep pace with the rising cost of living. The income-to-housing affordability gap continues to grow. For countless individuals and families, survival now depends on government assistance programs or community support initiatives. Yet, these efforts are often stretched too thin, unable to meet the overwhelming demand. The housing crisis isn't just an economic issue, it's a humanitarian one, and it's pushing Canada to the brink of a national disaster. As if the housing crisis weren't enough, the overall cost of living in Canada has spiraled out of control. Groceries, utilities, transportation, and other essentials have become unaffordable for many, with even basic items seeing drastic price increases. Over the past 2 years alone, the cost of a dozen eggs has more than doubled. Gas prices have hovered above $2.50 per liter for so long that many Canadians now struggle to afford even the most basic travel. Inflation is currently sitting at a staggering 7.5%, significantly reducing the purchasing power of families and leaving them with fewer resources to cover their basic needs. The financial burden doesn't end there. Food banks, which were once a last resort for those living in poverty, are now seeing a 50% increase in demand from middle-class families. Parents who once took pride in providing for their children are now forced to rely on charity to make ends meet. Fun activities, family vacations, and even simple outings have become luxuries that most Canadians can no longer afford. This has created a growing sense of despair and frustration, as citizens grapple with the realization that the quality of life they once took for granted is now slipping away. Adding fuel to the fire are accusations of corporate greed. Grocery chains and large corporations have been accused of inflating prices for profit, further straining households already struggling to survive. While the government has made some efforts to regulate pricing and curb inflation, these measures have largely fallen short, leaving Canadians to bear the brunt of rising costs. The rising cost of living is not just an economic issue, It's also taking a toll on mental health and social cohesion. Families are making heartbreaking decisions, such as skipping meals, cutting back on heating during the winter, or taking on multiple jobs just to stay afloat. The stress of financial insecurity is palpable, affecting relationships, mental well-being, and overall quality of life. For many, the Canada they once knew and loved is becoming unrecognizable, a far cry from the land of opportunity it was once touted to be. Canada's healthcare system, once a shining example of universal access and equity, is now crumbling under immense pressure. In 2025, the cracks in the system have widened into gaping holes, leaving millions of Canadians struggling to access basic medical care. The wait times for surgeries and specialist appointments have become unbearably long. For non-urgent surgeries, patients now face an average wait time of 18 months, a delay that can drastically impact their quality of life and, in some cases, even lead to preventable deaths. Emergency rooms, once a safety net for those in immediate need, are overwhelmed to the point of collapse. Patients wait for over 12 hours on average to see a doctor, with some leaving without being treated at all. One of the root causes of this collapse is the mass exodus of healthcare workers. Burned out, underpaid, and underappreciated, many doctors, nurses, and support staff have left the profession in droves, leaving hospitals and clinics understaffed. The effects of the COVID-19 pandemic have further exacerbated these issues, creating a healthcare system unable to recover. Chronic underfunding has left hospitals and clinics unable to meet increasing demands, particularly as Canada's aging population requires more intensive care. The result is a healthcare system that can no longer cope with the needs of its citizens, leaving many feeling abandoned by a system they once trusted. Stories of preventable tragedies are becoming alarmingly common. Patients with treatable illnesses are dying because they cannot access timely care. Those with chronic conditions struggle to manage their health without regular checkups or specialist consultations. Families are left devastated as loved ones succumb to illnesses that could have been managed with proper medical attention. The healthcare crisis in Canada is no longer just a problem for those in rural areas or lower income brackets. It is affecting everyone, from the middle class to the elderly and even children. The government has attempted to address these issues through funding increases and policy changes, but these efforts have been slow and insufficient. Meanwhile, private clinics are becoming more common, offering expedited care for those who can afford it, further deepening the divide between the wealthy and the rest of the population. What was once a source of national pride has now become a symbol of systemic failure, leaving many Canadians wondering if their healthcare system can ever recover. As if the healthcare collapse weren't enough, Canada's climate is becoming increasingly unlivable due to the escalating effects of climate change. Wildfires, once a seasonal concern, have now become a year-round disaster. Provinces like British Columbia and Alberta are ravaged by massive fires that destroy homes, displace families, and wreak havoc on air quality, making it difficult for anyone to breathe safely. The effects are not confined to the wilderness. Urban centers are also feeling the impact, with smoke blanketing cities and causing respiratory issues for vulnerable populations. On the other end of the spectrum, heavy rains are causing catastrophic floods in places like Montreal and other urban centers. These floods displace thousands, destroy property, and put immense pressure on local infrastructure that is already struggling to cope. Meanwhile, summer temperatures have become unbearably hot, regularly soaring above 40 degrees Celsius, 104 degrees Fahrenheit, creating hazardous conditions for the elderly, children, and those with pre-existing health conditions. Despite promises to reduce carbon emissions and invest in renewable energy, Canada's progress has been painfully slow. Decades of inaction and reliance on fossil fuels have left the country ill-prepared to deal with the immediate and long-term impacts of climate change. Flood defenses are inadequate, wildfire prevention strategies are underfunded, and renewable energy projects are far from meeting their goals. The costs of inaction are now being felt daily, from destroyed homes to billions of dollars in damages and lost productivity. The psychological toll of these climate disasters is immense. Communities that once felt secure now live in fear of the next wildfire, flood, or heatwave. Farmers are losing crops to extreme weather, further driving up food prices and threatening Canada's food security. For a nation that once prided itself on its natural beauty and resources, the rapid deterioration of its environment is a devastating blow. Climate change is no longer a distant threat for Canada. It is an everyday reality that is reshaping the country in real time. Without bold, decisive action, the costs will only continue to grow, putting even more lives, livelihoods, and communities at risk. Canadians are left to wonder if their leaders are willing to take the necessary steps to protect the country before it's too late. Canadians' frustration with their government has reached unprecedented levels in 2025. Once known for stable leadership and a sense of unity, the political landscape is now defined by broken promises, scandals, and a lack of decisive action. Bold campaign pledges to address critical issues like housing, healthcare, and climate change have largely failed to materialize, leaving citizens feeling increasingly disillusioned. Public confidence in leadership has eroded, and many now question whether their government is capable of navigating the immense challenges the nation faces. Mass protests have become a regular occurrence across the country. These demonstrations, fueled by anger and frustration, reflect a population that feels unheard and abandoned. Movements advocating for affordable housing, healthcare reform, and climate action have gained traction, but they've also polarized the nation. The growing divide between citizens and their leaders threatens the stability of the political system. For many Canadians, the lack of effective governance is just as alarming as the crises themselves. At the heart of the issue is a sense of stagnation. While leaders make grand speeches and introduce incremental policy changes, the scale of the crises demands immediate, transformative action. Instead, bureaucracy and political gridlock delay progress, further deepening public discontent. The government's inability to address these issues effectively has created a leadership vacuum, leaving communities to fend for themselves. Canadians are left wondering if their political system can rise to the occasion or if the nation's problems will continue to spiral out of control. Adding to this growing frustration is a mental health crisis unlike anything Canada has seen before. The combined weight of financial struggles, healthcare failures, and climate anxiety has taken a devastating toll on the population's mental well-being. Suicide rates have climbed sharply, and the demand for mental health services now far exceeds the system's capacity to provide care. Canadians are facing immense psychological strain, but the resources to support them are woefully inadequate. Access to mental health services remains limited, particularly in rural areas where options are scarce. Even in urban centers, the wait time to see a therapist or counselor can stretch into months, leaving individuals without timely support during their most vulnerable moments. The stigma surrounding mental health issues further complicates the problem, discouraging many from seeking the help they desperately need. Isolation, fueled by the unaffordable housing crisis and a lack of community spaces, has left countless Canadians feeling alone and hopeless. The mental health crisis isn't just an individual problem. It's a societal one. Families are struggling to cope with the emotional fallout of economic insecurity and climate disasters. Communities are grappling with the loss of connection and support that once defined Canadian life. Without significant investment in mental health care and community building initiatives, the crisis will only deepen, further eroding the social fabric of the nation. Despite these challenges, pockets of hope remain. Grassroots organizations and nonprofits are stepping in to fill the gaps, offering free or low-cost mental health care and creating programs to reduce isolation. Communities are coming together to support one another, building a sense of solidarity in the face of adversity. But these efforts, while inspiring, are not enough to address the systemic issues driving Canada's mental health crisis. Without bold action from leaders and a renewed commitment to mental well-being, the country risks leaving millions of its citizens behind. In the midst of Canada's struggles, there are glimmers of hope emerging from grassroots efforts and community-driven initiatives. Across the country, local organizations and individuals are stepping up to tackle the challenges that governments have failed to address. In the housing sector, communities are working together to develop innovative solutions, such as co-op housing projects and tiny home villages, to provide affordable living options for those in need. These initiatives, while small in scale, show that Canadians are willing to come together to support one another in times of crisis. Efforts to combat climate change are also gaining momentum at the local level. Small towns and neighborhoods are investing in renewable energy projects, such as solar and wind farms, to reduce their dependence on fossil fuels. Communities are organizing tree planting drives, setting up urban gardens, and creating green spaces to combat the environmental damage caused by urbanization and industrialization. These projects, driven by ordinary citizens, demonstrate that change is possible when people take matters into their own hands. Mental health support is another area where grassroots efforts are making a difference. Nonprofits and volunteer organizations are providing free or low-cost counseling services, creating safe spaces for those struggling with anxiety, depression, and other mental health challenges. Online platforms have also emerged, connecting people to virtual support groups and mental health professionals. These efforts, while limited in resources, are lifelines for many Canadians who would otherwise be left without help. However, these community initiatives are just a small piece of the puzzle. They highlight the resilience and ingenuity of Canadians but also underscore the failure of systemic institutions to address these crises effectively. For every person helped by a co-op housing project, hundreds more remain without shelter. For every tree planted, there's an oil pipeline expanding. The scale of the issues Canada faces requires action on a much larger level. Action that only bold governmental policies and systemic reform can provide. This brings us to the critical question: can Canada overcome these challenges and reclaim its reputation as one of the best places to live? The hurdles are immense, and the road ahead will require significant sacrifices, bold policies, and a united national effort. The people of Canada have already shown their determination and creativity, but systemic change must follow. Governments need to prioritize affordable housing, healthcare reform, and climate action, and they must do so with urgency and transparency. The story of Canada in 2025 is far from over. While the challenges may seem insurmountable,